Hi friends, most of you would be wondering which one is better, whether it's basal implants or conventional regular implants. So before going to the discussion of basal implants and regular implants, I'll just give you some basics of the bone. So our jaw bone actually has two parts. The tooth containing part is called the alveolar bone, is made up of cancellous or slightly soft bone, whereas the bone below the alveolar bone is a cortical bone or the basal bone. It is much stronger bone, and this stronger bone does not resorb at all. That is, it does not get reduced at all. Whereas the cancellous bone may get reduced to a small extent. So while the regular conventional implants are placed in the alveolar bone mostly, and sometimes it may engage the lower basal bone, the basal implants engage completely in the basal bone, thereby leading to a stronger anchorage. And another difference between the basal implants and the conventional implant is that the basal implant is a single piece system. That is, the part which is replacing or replicating the tooth root and the part in which the crown is fixed is all a single unit. Whereas for conventional implants, it is a two-piece implant system. The part replicating the root is a separate component, and the part to which the crown is attached is a separate component, and these both can be removed. So why is this important, whether it is a two-piece or a single piece? The surgical aspect, that is how the implant is placed inside the bone, is absolutely fine for both basal as well as conventional implants. Actually, because the basal implants are placed in the basal bone, it may have some additional advantage as well, because the basal bone does not resorb. But the prosthetic aspect, how the crown is, how the artificial tooth is fitted onto the implant. So what we finally need is the tooth. We don't know whether it is an implant or something. What we need is a tooth. So how that is fitted onto the implant is what is important. So since the conventional implants, they are two-piece implants, so if you place an implant in this direction, the part in which the crown is attached can be selected based on how the implant is placed, and the crown can be fixed. So even if there is a need for any adjustment, this adjustment can be done outside the mouth in a lab, and it can be refixed to the implant and the crown can be fixed. Whereas basal implants are single piece implants which cannot be removed. So once it is placed in the same direction, this implant has to be bent to give a proper crown. And if there is a need for any reduction or trimming of the metal piece, this all trimming is done inside the mouth itself. So while the regular implants have more precision with relation to its components, basal implants have very less precision. So when we are comparing basal implants and conventional implants, for replacing a single tooth or two teeth, you can use either basal implants or conventional implants. But if you are going for a full mouth rehabilitation with implants, it is always preferable to go for conventional implants. I hope this video was useful to you. Please like this video, share and subscribe to the dental channel. And if you have any questions, you can post it in the WhatsApp number 90952 80903 or also in the comment section below. Thank you.